things I look for when I assess somebody, right? What is assessment, you ask? Is that right? What is assessment? What is assessment?
It's just looking and listening.
Looking, feeling, listening, noticing what catches your attention and what you want to do about it.
Okay.
Right? Assessment leads the way to your sessions, right? So in massage, we didn't assess a lot. If you come in through a massage door, we just rubbed and things got changed, right? Yeah. But with ortho, we actually need to figure out clues, right? Because it's like reading the great mystery novel, right? Terry is my novel, right? I know possibly what's bothering her, but I don't know why. Does that make sense? So assessment is kind of how you unravel the mystery. Does that make sense?
Do you have a conversation with them when they come in the door?
Yeah.
Do you say, hey, what's going on?
Hey, what's up today?
So happy to see you, but why are you happy to see me?
Yeah. No, always. I always ask them, where do you want me to orient today? Is something happening? Did something change from the last time I saw you? And if they say we're in the same old place, rarely, right? Or they'll say, yeah, that's all better. I forgot I came for that. But now this hurts, right? So when she's face down, I just start off right off the bat. I look at what shape her back is, right? This is a visual assessment, right? Are you with me? Okay. And I notice, what do you notice about Terry?
She's got a nice round back.
It's a little flat in my point of view.
Well, not where
Yeah,
I'm
there's not much defined curves.
That'd be flat.
Yeah.
The world ended
My
on
back is
top.
really flat.
You want to see a really flat?
The world is
but
flat.
she does have a little thoracic curve. But what I really see, and don't believe everything your eyes tell you, because the clothes will really be deceptive. Like if there's a seam going crooked, you'll think, oh my gosh, they have scoliosis if you believe this, right? But I do notice that her curve is minimal, right? This curve is actually okay. If she had a curve down here, I'd be happy. But since she doesn't, I worry. Right? And then I would want to notice, and she has a curve here as well. So you want to kind of notice, does the spine have any shape other than a straight line, right?
Hopefully.
Right. Well, hopefully, right? But Terry doesn't
Doesn't
today, but I'm okay with that because I know Terry's healing, right? And the other thing I want to look at and I want to notice, right, is if I just look up, right, I notice that she actually has a downhill slant little bit here, right? She has a little downward slant here, right? So I just notice visually. I can also check in with her scapulas, and her scapulas are in a pretty decent place. But sometimes you'll see a scapula that's flared up, slid down into the armpit, right? You're like, where is it? Right? It's way down here. And I want to notice that, right? So you want to get your bearings a little bit. Like, what do I notice? What looks kind of off? What looks kind of okay? And I agree with you a little bit. I think I would be less worried about this region than this region, just because I see that downward slant, right?
And I can't see that from where I'm sitting.
No.
I just saw the in the
Right.
middle. So I didn't
Right,
think
and
about
that's actually not too bad. I agree with you now, right? At first I was like, it's pretty flat, but now I'm like, okay, wait, in perspective, this part, I wouldn't jump on this immediately. The next thing I want to do is just kind of palpate and feel where things are tight, because what I really feel, sorry, Tara, what I really feel is probably more accurate than what I see, right? But I'm very visual. Melinda's not visual. When you study with her, she's not visual. She really senses things. So her assessment comes in energetically. Does that feel stuck to me energetically, right? Or does that feel okay, right? So she kind of assesses from up here, and I assess down here. And then she can do that too, but just trying to give you examples. So
And
what I want to do...
Sherry, from this angle, the slant was really obvious when your hands were on her, but it isn't obvious without.
Right. Isn't that interesting? So I can, when I land there, I can
Yeah,
check
very
that
cool.
out,
Yeah.
right? It's,
Cool.
you can see that she's pulled over and down, right? And so when I actually palpate her, but I'm gonna just notice, and actually the side that feels tight and puffy to me is this side, right? So that, and then I think, okay, so maybe the slant is actually the good side, and this side is the side that's in trouble, right? But if I looked at it, I would have jumped here. So trust your hands. So you want to palpate around and see what's tight. We'll see what's sore. And she's going to kill me if I just keep palpating and don't do anything, right? Right? So I'm just going to just bring that ilium towards that little palpation. Is that okay, Tara?
Oh, yeah.
Jumped in. Oh, yeah. So I'm just going to treat her for a second, because one of the things I hate is when people assess on me. They don't do anything. I'm like, come on, bring it. Do something.
You're doing the ilium, you don't have to have them flare their leg out. That's just another way of doing it on the side. Or you only do that for him.
The
like
proper
this.
way to
Yeah.
do the ilium rotation is to do it the way they say in the book. The cheater way is to do the way that works, right?
So
Yeah.
she's doing the opposite thing
Yeah.
because I was just.
Right? It doesn't matter as long as you can feel a gift. Now, if I do that once and I don't feel a change, I'll do it the proper way.
Okay.
Does that make sense? But you're gonna develop your own shortcuts. Right? So the other thing I want to do, I'm gonna palpate around the sacrum, right? Just check it out. Is it tight? Is it sore? Is it off to the side? Does it feel goopy? Does it feel not goopy?
Hard.
Yeah,
Sometimes
hard.
it's just
That-
tight and it won't move.
Yeah, that's
stone.
assessment, right? The other one that I check on a lot is when you come down off the sacrum and you're following just down on her sacrum. She has such a good sacrum. There's always a little dense spot that is your piriformis. It's the beginning of the piriformis, and even though the piriformis is quite deep, it shows up superficially right here, right? And you don't have to palpate to their guts to feel the piriformis. No, because people think they do. Well, the deeper I have to go. It's actually not true. This little fascia pattern right here will show you how that piriformis is doing, right? And you'll feel it. It's like you're coming down, it's all smooth, maybe a few bumps here, and then you'll feel this like ribbon that feels like this. And for her, I'm gonna just compare what I notice and her notice, because sometimes I jump to the wrong conclusion. But I think it's this side that hurts, or is more tender, or more puffy, or tight. This one or this one? What do you think?
No, it's because of this ankle.
So she has resolved all her own problems. So I'm gonna cross that ankle and treat the piriformis real quick, just because I don't wanna assess her into the ground, right? And she's fresh. She's fresh meat. So I got this. There we go. Yeah. But you know what I mean? Oh, that helped.
Yeah.
I was gonna ask how much you do kind of check in with them. You're doing your own assessment, do you kind of say, here's what I'm feeling, or is it more, you know that in your head and then you're checking in with them, so as not to kind of maybe confuse,
Yeah.
or, put your own.
Both.
Depends on the
I knew you were gonna say that.
Well, because sometimes I'm like,
Consistency, Sherry, I love it.
I know, or not, right? But one of my faults is I don't check in enough. Knowing that about myself, I wish sometimes I did just not assume that was what I felt. And sometimes I wish I talked to them. But here's the other thing I know for sure. Sometimes I'll palpate and I know it's off. I felt how many 100,000 people. So I go, okay, that I know is that's giving me signals that it's not okay. I know in myself, I know in my experience. And so I just treat it. And if I ask them, they go, no, it's fine. But if I stuck 5 seconds longer, they'd be go, ow, what are you doing? Why does it hurt now? And it's just because their awareness had to arrive long before mine did, right? So I just work with it, yeah.
And I find that with inexperienced clients, sometimes you can overwhelm them by asking too much.
Yes.
Because if their answer is I don't know, by the second I don't know, I'm going to be really reluctant to ask about any other part of the body, because they feel insecure and really stupid, and I don't know what I'm doing.
Right.
So
Yeah,
I
they
just
think
say,
you're
it's
stupid.
okay. And if they say I don't know, I say that's fine. You don't have to.
Or
We
they
got
just
it
think
covered.
you don't know what you're doing.
Right.
And sometimes they think you
Oh,
don't
and
know
I
what
gotta
you're doing.
write
That's
this
good
guy
part
a
too.
check, right? So, okay, so then I want to palpate up along the spine, and she has a million places now. Like from here on out, it's fair game. I could do anything, right? So I want to palpate along the spine. And then let's say I notice something like, ooh, right here, right? That feels a little off to me. So I can also palpate who else feels tight around that, right? So you can go really micro, and then you can add other pieces in. Does that help?
Yeah,
So
I think it does.
Yeah.
The woman on the table's good.
She's like, making sense to me. So if I'm here and I notice that, and let's say I kind of move these guys in relationship a little bit, I'm assessing, right? And I notice, okay, when I hold here, the scapula likes to go up here. So I'm just gonna work with what I notice in those two pieces, right? Now the other thing that could happen though is what if it's tight from this side? So I do this and I notice, okay, that's softened up a little bit. And rather than going back and beating the same horse, I would want to maybe spread out even farther, right? So my assessment might lead me to assess another side, right? And so then I could say, oh, but when I'm here and I do this, she likes to come back towards that spot. Oh, and it softened more. So my assessment needs to be small, and then it needs to be large, and then it needs to be small, and then it needs to be large, right? So you're gonna, and that's how you know what to do in a session. So it's not just you do the same pieces on people and call it a day. I can do feet, I'll do my feet. Here I am doing my feet, right? You actually wanna notice what's happening on a bigger level in them and a smaller level in them. Does that make sense? Okay. So, and she gave me a huge chunk of information verbally that I can add to my assessment. What did she say? She said the ankle. My ankle's bothering me. Well, then I'd be like, okay, I better include this ankle. To be specific, right? Like, I know which one now because she's like, choose me.
You have to honor what arises.
So I'm just gonna meet that, and as I go into palpate and connect there, oh my gosh, she's swollen, it's hurt, I can feel, like, look at this, wowie, right? So I've got myself a sprained ankle. No wonder why her performance is tight, she's limping, right? Even though she's glowing. So then I'm gonna palpate without hurting her, which I think I am.
No, you're not.
I haven't yet? Okay. I thought I maybe should have been a little gentler on that swollen. But I'm going to palpate along the edge of the foot. I'm going to just notice this tightness. Oh my gosh. And I choose it, right? I could do anything in here. And all I'm going to do is squish her, right? Just try to, because the whole thing is tight. So a little quick fix for tightness is to give it more tightness, right? Oh, you're really locked up. I'm going to just show you locked up. And then I can read palpate and see if there's something more specific I can do, right? When in doubt, show them what they're already doing. You're swollen, you're locked, you're stuck, right?
Would you, like, around that area that's swollen, would you want to do like almost, if it's sensitive, obviously you don't want to put pressure on it, but you could almost like put your hand over it and like do like a small volley on it
Yes,
to help
totally.
the fluid? Okay.
Yeah, but where you want to check is, in the anatomy world, they call them bony landmarks.
Yeah.
So anywhere that there's a bone that juts out, you can check and see what's going on around there, right? And she told me right here, like on the back side of her fibula, which is our knee point 4, one of our great knee points, she's got a lot going on, which I know is coming from here, but probably even still affected by this. So I have that right there. Finding this little landmark right here helps me know I need to go down and I need to go up. Does that make sense?
Why again?
Because it's tight and congested. So that's something I want to, as a little practitioner, I want to feel like, what does this feel like? Oh, it feels pretty good until I get to here, and then it feels really tight and congested. So I could do what Sasha just suggested and just do a little pulsing in there, right? Just kind of work with that fascia and that congestion around the bone, and out she rotates, right? So the structure's moving. That's the glory of having reflexes, right? Because I can meet something real quick in my assessment and it'll shift. And now there's some movement in there, right? The other assessment you can do, because that's a little assessment, is you can do a big assessment. You can just say, how do you, exploration of movement, right? Can you do this? No. Can you do this? No. But she can do this, right? Okay, that's good to know. So does that make sense? So you want to start looking macro, micro, micro, macro, you know? They taught us points, and then we did them. And then what happens when you weren't on a point and it was all messed up?
Or you couldn't remember the point.
Yeah, thank you.
More commonly, it's like, it's just a vacant lot in your point department, right? Yeah. So that's one of the things you can do. You can palpate around any bone, any bony landmark. Up the side of a bone is really good. Around a joint, right? You can check out and just see if things are level. Like I'm gonna find her sits bones. Great assessment tool here, right? Here's her sits bones A and sits bone B. Are they in harmony? Are they congested? Do they feel swollen? Do they feel gooky, gumpy, or another word? Sometimes they'll feel
Lively. That'd be
crystally.
the opposite.
They'll feel
And then vacant, that was a word.
Vacant.
Yeah, vacant, very.
Yeah, like sometimes you'll go to find a bone and it just won't show up for you because whatever else you're feeling is the most important thing, and the bone is like, shh, be very quiet. I'm not interested in being treated, but I'd like her to get to the fascia today, right? So different parts will rise and meet you, and different parts will collapse and say, not me today, right? Okay.
I'll tell you that this is the hip that they did radiation in, and that's probably why it's sloping.
It's congested
Yeah.
too. Her fascia's congested from the burn, right? And that has a different feel to it when the fascia's been affected, and you do feel it in radiated tissue. It's like they nuked it, right?
Yeah.
So then, just like anything that gets nuked, it changes a cellular level. It changes a cellular.
It's like a mesh of scar tissue.
Yeah, exactly.
And can that be recovered or repaired, or is it just kind of?
I agree with Jim. I think sometimes in phase 6 to start with, and then eventually in the actual tissue, we can. I mean, there's times you're doing work that feels like so minute. You know, you're like, is this really that important? But then you work for another 5 or 10 minutes, and you feel something let go, and then something like go, let's go, right? So sometimes the tiniest thing, this little intrinsic thing that you notice, is important to the whole spider web, but it doesn't make sense to you. Does that make sense?
Yeah.
So little tiny, you might be able to go back once it's calm, to go back and really notice like, oh, this part of the fascia likes to go this way. But if I go down here, it likes to go this way, right? So assessment has that ability to be really refined. So you can palpate bony landmarks around something that looks sore. I can also look and just see like what you did yesterday kind of, and the day before, and weeks for that. She has this little pattern going, and then she comes out, so I can look at that and just notice. And maybe I'd add an isometric in here. So I'm gonna have you push out against my hand and stop. And I'm just gonna fall through, and don't push back.
Okay.
Let it go. Yeah, there you go. There. And then I just notice if it shifts or not. And she just went right back to where she started,
Yeah.
right? Yeah, I'm gonna do the back and head that way. One of the places I assess a lot is I run my hands along the edge of the rib cage just to feel the visceral. I start here a lot. And it's crazy how bumpy it is. Like, she's actually pretty good compared to some people. Sometimes they're just like super locked down, right?
So is it just at the under edge of the ribs or?
I go under, but you can go above.
Okay.
But you just want to notice. Sometimes they'll feel swollen. Like when that liver's swollen, it pops out under the ribs and it feels like a little layer of like a bloody, a tube that's filled with fluid, right? And you'll be like, what the heck? And it's tender because the liver is so swollen, it's popped down and under. And I always check that.
What if you can't really I mean, I know this is different, but in massage sometimes, you do that line.
Mm-hmm.
But like sometimes you can't even get, it's so tight in there.
Right.
So like if you're palpating,
And she doesn't have it. Like
Right.
she really has really vital. It's very alive and springy in here. Do you see how I come in? Oops, no, it's not.
Oh.
I made her worse. So I'm gonna just do a little baller until she's springy. There she comes out. But you see how I can actually palpate her.
Yeah.
And you'll see people that are so bloated
Yeah.
and tight and like sausages
Yeah.
in there. And then you just want to start with that.
Right.
Like your assessment is immediately apparent.
So when you get people that are like
Visceral
that, you're like
Yeah.
liver, colon.
Right. Liver, colon, small intestine, whatever, because sometimes what you're actually finding is that they're so inflamed inside their bowel, the lymph is flooded to help the inflammation come out, and so then their bowel is hugely inflamed inside and out. So you can work inside the colon. I promise we'll teach you that. I think there's a piece in the next 2 days. But you can also just connect and work with the puffiness, the swollenness.
And
And it
to
feels-
work on that, it's just phase 5, or
Yeah.
maybe a little volley.
Maybe
Or
worry.
ongoing.
Or if there's a dominant pattern, like let me just connect here. She has one here. It has a little twist in it, so I just say, hey Terry, here's your little visceral pattern, here's your visceral pattern. This is like visceral 1, like 1, you know.
I do a lot of this work, but I don't know what I'm doing.
Exactly.
All I know is the body's like, please.
That's all that you need
So,
to do. Yeah, I mean, eventually you'll get more skilled at defining what you're doing, but honestly, if you show up and you just hang out with someone and you are clueless, but you know it's swollen and tight and tender, it's gonna help. I mean, that's working. What we're doing is helping her. And she's not acute, like, you know what I mean? Like, but I can feel.
Could you say that would be true for anywhere you're working? If you just show up and are there,
It helps.
yeah,
Because the neurological system is like, oh, there I am. Okay. Oh yeah, that's really been bothering me. Because being met is one of the most powerful things you can do for a body. Being present is the most perfect healing combination of anybody's experience, right?
Real quick, where do you find when you're all up viscerally, kidneys?
Kidneys, love that. Good question.
What did you
We'll probably
say?
show you again tomorrow.
Yeah,
Just behind the lower ribs,
Yeah.
on both sides. There's
so
usually.
there's nowhere,
kidney.
because yesterday you said
Oh no, that's a Chapman's point.
that's a Chapman's point.
Yeah, but
Okay.
actually, what's kind of interesting about the Chapman's
I was
points,
like, wait a minute.
the kidney's over here, but the cap, that is the adrenal cap, sits on top of the kidney, which actually lines up with the point. So here's kidney point, which is kind of in relationship to the kidney, but it's the cap that it lines up on almost perfectly.
Cap.
The
adrenal.
on top of your
The
kidney,
hat.
there's a little adrenal gland.
Right.
That looks
Yeah.
like a little
Chinese
like
hat.
he's-
Hat.
Yeah, a little cat, like he's gone snowboarding. Right?
Uh-huh.
Yeah. So and that lines up almost perfectly with the Chapman's points.
And are those across from from the belly button, or where are
It's
those at?
an inch over from the belly button, an inch up hits your kidney points, an inch up more hits your adrenal points. And if
And those are
you,
chapped.
so you can check the back side, that phase 5 psoas release we taught you.
Yeah.
I assess that every time. Okay, then the other place I like to assess on structure is along the sternum. You can feel twist and turn in that fascia superficially, but you can also feel a lot of Chapman's and sore points on the ribs. You feel it on yourself? I check those every session.
So is this point right here, is this what you were talking about when you said you could feel the rib?
Yeah, that's
Okay.
a rib. The third rib pops up higher.
Always sore, like right here.
That's thyroid
Oh, yeah.
in one. You know. But you know what? When you feel your thyroid stressed, you can get right on those little knobby points and just work with them with like ongoing actions, vollries. You know, just hold them and let the heat come off. And it's really amazing how much they can help you. Right? I kept my thyroid issues at bay for a long time just doing Chapman points. So I checked that out. I can palpate around an arm. I can palpate along rib.
Yeah.
Right? Are you getting what I'm saying?
Yeah.
Okay, good. Clear?
Picking up what you're throwing down.
Good. Anything
Kidney's
else?
really on the bottom side of the liver. On that side.
Yeah, it's kind of, in actuality, it sits a little bit lower, but
Lower
it's,
than the rib cage. No.
Well, no, that's not true, because in some people, like, you'll go, okay, where's that kidney? And I have to move down 3 inches, and there, it actually,
I usually find it because it's so far.
it hangs
Yeah.
out. It can, you know, depending on what's happened in their life, some kidneys sit a little higher, some kidneys sit a little lower, some sit like this, some sit like that.
Right.
Liver tends to be in front too, I mean,
Front and wide and big.
compared to the kidney.
Yeah, but I
Right
mean, the
up
liver
against
goes all the way over to the, if it
Right.
starts here, it's like the football field of organs, right?
Right.
It's huge.
But that part of the liver, is it up more under the rib cage?
Sometimes, in theory, it should be because the stomach's right over here,
Yeah.
right? And the lesser omentum's there. So, yeah, sometimes. But you never know, because not everybody landed in the same place, and different events change our organ positions. What else? Like what you said.
I do have, and I don't know
Please
why I
do.
have this question, but you know, there's some, and typically it's men, But they have that very round, distended abdomen. Like, do you just kind of start there and see who's talking the loudest? Or is it just everybody's just super big? Like that just blows me away.
I think there's a couple things that you have to consider on that. And one is a lot of men and women, that's where their fat goes, right? So you're dealing with the adipose tissue.
Sure, but I mean, some like it's just like you can tell. I mean, it's just a distended. It's a very
Yeah, and
And
a lot of
hard sometimes.
Yeah,
it's
that's
hard.
hard.
I think it's a combination. They might be more inflamed in their colons and less aware of it because they work differently than we do. Hormonally, they work differently. They don't have all the congestion of the hormones in their gut the same way we do. It's just a different world chemistry-wise for them. We're far more complicated on the chemistry world, I think, but they have their own stuff, right? And I've been thinking the same thing that you're saying is like, am I feeling just that's where their fat goes, and they have absolutely no cellulite on their legs, so they aren't storing anything there. They could wear high heels and look better than me.
Right.
So then I think, okay, so am I dealing with just that's where their adipose grows, or is that a bloating from inflammation? If it's inflammation, I should check that out. Should check out their you know what I'm saying? It's more than that. What gets me is when it's super big, and this can be on a woman too. I mean,
Sure.
you know, you have
Yeah.
I mean, the women that just carry all their weight in there, and then you're more likely for a heart attack. I mean, there's a lot of bad side effects of carrying your weight in your gut, right? The other thing is, I think, is what happens if you have weight and it's pulling down, right? What happens to that fascia? That fascia, that superficial fascia, not your greater omentum fascia, but the one right under your skin, is always got this weight pulling on it, which happens, what happens then, right?
Yeah.
Right? It just melts you over, right? It's the same with big breasts. I mean, they just eventually pull women this way and crash this part of their back, right? So I just think about what I'm dealing with and how to help it.
I guess I just think of it because especially when the men when they're really I don't know I haven't seen it so much in a female I don't know whatever. But anyways, like that air, or is it just air?
It can be lymph, gas, air,
I mean,
fat.
and I mean like gas, not even like gas. Like it feels like it's just like
Like a balloon that's been inflated.
Yeah,
and
yeah,
that
and
can
it's,
be
Not
it's
air.
tight,
It's
there's
not
like,
air.
That can
I
be
think that
gas.
was a lot of inflammation.
Right.
It feels like that to me when I have someone with a lot of inflammation here. Whereas if it's fat, it doesn't feel that.
yeah no.
Or
I
you
mean,
won't
both.
feel it.
Sometimes you'll get both. You'll get a lot of adipose tissue, a lot of inflammation, a lot of lymph because the body's now surrounding the organs with all the inflammation, and right. And then I find when I work on it and it's lymph, then the swelling will go down pretty quick. When it's gas, internal inflammation of the colon, it tends to take longer.
Sure.
But they still need to drink aloe, and I mean, they're not different than us in that irritation of the inside of the bowel. It hurts
Right.
just as much, and,
Oh right.
and they bloat. No, it is because there's stress in there. There's stress from the fascia. There's stress from the greater omentum. There's stress in there. It's a lot of stress.
I would also toss in that you're likely to be dealing with sleep apnea.
Yeah, because of the smell.
I mean, like 90% of the time, they're gonna have sleep
Sure,
apnea,
right.
often undiagnosed. I would tend to work on a person like that on side position a lot more than prone or supine, partly because of the stresses that Sherry's talking about, that it takes all this weight. If you're supine, then you've got all this extra weight that's crushing your organs. So if you get in the side position, then you can have some access there that you wouldn't have. And sometimes it will, that balloon, that tight balloon feeling will soften quite a bit when you get them into side position. And now all of a sudden, you can start to move things around.
That makes
weren't available
sense.
before.
But just like a
Yeah.
pregnant woman, when a pregnant woman rolls on her side, you have to put a pillow under the side she's on,
right,
right?
to support the.
So the
it's
baby
not
doesn't
just
just
pulling.
pull,
Yeah.
right? And the same with the gut. If you can get a pillow under that gut, without them becoming really conscious and embarrassed about it, right? Because you don't want that.
Yeah.
Then a lot of times that gets that fascia, that slack too.
Interesting.
Well, so
Yeah.
say more about the breasts, because I've got
Heavy-breasted
and
women.
this and then that here.
Yeah, it just, there's a wear in the system, and it happens anywhere. It can happen like in their early 20s, but usually by 50, heavy women have horrible neck issues. Horrible from
And
the
shoulder.
wig. Neck, shoulder, mid back, lower back. Yeah.
And you just
And then
help break that
the
down.
other thing is women who have small breasts and then get breast augmentation and they go way big and then they're not strong enough and so then their back hurts so bad from, you know, from not even
Literally
having the
having
muscular.
that.
At least when you're young and you're growing up and growing bigger boobs, your back's getting stronger at the same time. There's an advantage, right? Where little boobed women that go to big boobed, I think there's a huge weight disproportion that throws off their pelvis, their endocrine system, let alone, you know, how many broken silicone things have I seen in my practice in the last 10 years? More than I could have ever dreamed of. Right?
Even if they don't break, you can get mold development around it.
Yeah.
It's just, it's all.
They say they leak or
hideous.
break within 3 years.
Well, and
Yeah.
I just had a client take hers out that were leaking,
Yeah.
and the same day they put in new ones.
What?
And
They didn't let
she
it
was
go.
telling me I have this heart thing, and I was like, well, maybe it's just left over from that tissue that I didn't know they put new ones in. Like, where did I miss the boat on that? I was like, I thought she got them out because she wanted them out and she didn't want new ones. And she said, no, they put new ones in, smaller ones, different ones. And I was like, huh. I think that's why you're having heart palpitations. I could still feel the fluid from, I wonder if they broke already, or if her body's just like, you had broken ones in me before, get these things out of me. Like, you know, the intelligence is
Slow
screaming
suicide.
for, yeah. And she can't figure out why her heart keeps pounding, right? I think it's drowning, right? So the things that 25 years ago I didn't see, you know, and now I see, I can. I mean, I just look and think, oh my gosh, I unsprained a lot of ankles, right? And now I'm like having to ask questions like, what's going on in there? Do you have real ones? You're like, what's going on? Do you have augmentation? If you do, what's in it? Do you know what, you know, how long has it been in? Do you ever notice swelling under your arm? Do you ever feel nauseous after you eat? Yeah. Does your heart ever pound at night? Yes. Right? And then I'm thinking, oh, okay, you might want to go get this checked out. Right? And I had a woman who was swollen just in that lymph site here, which you'll learn in the next week. So this side, from right here down, all this lymph in half your head drains into one side of your body. The other one takes your legs and this whole side, right? So your lymph is divided literally like a quarter and 3/4, right? And she was only swollen on this side. And after working on her in one session, because she'd gone to a Rother who sent her to me, she's like, you gotta figure this out, I can't figure it out. And in one session, I was like, it's something on this side that isn't draining. This side is draining. Do you have augmentation? Yes, I do. Huh. She got into her doctor like in 3 days and they took it out and her swelling went away in like 2 weeks, right? It's like, ugh. But it was, thank God it was on the side that I knew it was that side.
And it
you know?
wasn't draining because they had leaked or because you just have a period?
I think it had leaked. The way I understood it is it had leaked. Her body was having a horrible response to it and was rushing lymph in there to try to clean up the toxic place, and then it was swelling up, and then it was making her neck buck and her brain foggy, and it was really typical. And I don't think is your liver in there? I don't think your liver's quite in that lymph section. But I think all of this is stuff you have to have in your awareness where I did not have to have it 25 years ago. There are 1,000 things you can do to assess the neck. Jim and I were talking recently that you can assess the anterior side of the neck, as long as you don't choke them to death, which is a problem.
Right.
So you have to be careful. But you can palpate along the backside. You can palpate along the sides, right? You have a structural issue, you have a fascia issue, and then you have a muscular issue. But it's the fascia tissue that will lock down the neck even longer than a structural issue sometimes. So. Okay, so I palpate a lot in the fascia. I'm going to take your little pillow away, which I always use to prop up my own elbows. So I really like to go put my hands down as far as I can. Some people, especially with the pad on my thing, I can get down pretty far and notice what's happening in the thoracics. And then I palpate along both sides. I just come up and palpate along both sides, right? I want to feel if one side's feels different, one feels the same, if they're both tight. Are they swollen? Because a lot of times in this region, there's a lot of lymph and fluids in there, right?
And you're starting like T1.
I like to start at T3, and then I work my way towards 7, right? And 7, no matter what, and you'll hear me say this again and again, is an epicenter for neck issues. It is often the place of major dysfunction and lockdown because it's trying to protect things upstream, as well as having its own leverage issues from us looking down. All that leverage just packs right into C7.
Do you see a lot more C7 now that there's so many electronic devices and kids grow up, like people grow up now?
I think I always saw it, and I do know that they talk about it as cell phone neck, now. And the axle, it's called axle loading. So you have a loading here, and then the other place it loads is right at C1, C2. And so that axle loading now, they say, has changed a ton, even on children, little ones. So I look for those 2 regions, I look at pretty hard. All right, so I just palpate up and along, right? If something catches my attention, let's say Terry did, I often check the relationship between the first rib that you guys just learned and the C7. I like to palpate along here too, right? If something's tight, I work with it. I can work with it in phase 4, I can work it in phase 5. I can push the shoulder in and shorten all that. I can push the shoulder down, right? But I want to check those regions. I want to check them. That's it. If I notice something's wrong, I want to meet it, right? So yourself is when you come off your ear, there's a thing called a mastoid process, and sometimes if you move your head forward, you can feel it more. That you want to palpate on either side of that. Is it tender on anyone?
Mm-hmm.
Yeah, you want to palpate on either side of that. No matter what, you don't want to skip that. You don't want to miss those transverse processes and the mastoid process there. It's a big clue to where their pain is.
But gently.
Isn't that more the C1? That's for C1,
C1,
C2.
C2.
Yeah.
That's our C1, C2 point.
What would be, just to remind myself, but like if it's C1, which is behind, right, and then C2's
Front.
C1's
C1
the
is
front. That's right.
Yeah.
And C2, what's your obviously, then you do a release for C1, but what's also your, what are you saying in relationship to pain as far as like what you think is going on? Am I being clear?
I think you're asking me, make sure I'm right,
Yeah.
what other symptomology might go along
Yeah,
with this?
as-
Jaw pain, tongue pain, sinus pain.
Okay, for C1?
Tooth
Okay.
pain.
Yeah.
Headaches,
Uh-huh.
axle loading, anything
Yeah.
that
And
goes
then
that way.
for C2, what would you more,
Ditto,
right?
and then you can also, again, even more into the headache region for some reason.
Oh, okay.
So I don't know why, but to me, C2 sometimes makes me, I think it has a lot to do, and it might just be the line of 2 in alignment, because a lot of times, so here's your C1, right?
Mm-hmm.
And here's your C2. A lot of times, let's say, with axle loading, it's gonna come up and push forward, and then this one's pushed back a little bit, right?
Yeah.
So you have this kind of patterning, right?
Yeah.
So this one is the one that starts to put pressure.
On the-
C2 puts pressure on the
right.
cranial nerves, actually more than this one, because this one's kind of pulling them, and this one's kind of pushing up on them. Does that make sense?
Yeah.
It's taken me years to figure
Well,
that out.
and
And the other way, it'll fall the other way, or it'll go this way, right?
in
Yeah.
between C1 and occiput, there's no
No
disc,
disc.
so
No
it
disc.
doesn't have much. There's no mobility really there,
Right.
relatively.
It can
I see,
spin,
right,
it
as
can
far as-
spin, but then
right.
you have ligaments and muscles that don't let you spin.
Right.
Can we talk about the little, what's it, the little thing, the little part of that C2 that comes up?
The little knob
Yeah.
that
Yeah.
circles
It
around.
is why it's called the axis, though, because it goes up through the atlas.
Yeah.
This comes
Like
up.
the dens.
The dens, that's it,
Yeah.
because that's what dens are. They're little knobs.
No.
And then I do always palpate along the edge of the occiput. Always. Always, always, always. I mean, you want to feel the difference. And here's what I have noticed more as I've improved, right? I feel more fluid in there than I used to. I feel more puffiness than I used to. And I think that's from that cell phone stuff. So I guess I have noticed a change, right?
It's gotta be, that cell phone thing is gonna cause so many problems.
A lot of headaches and eye
Computers
strain.
too, people kind of naturally.
And the computer,
Mhm.
but
The
yeah.
forward thrust.
Yeah.
So do you have a tip for necks that are really short and super far
she does not have this, but when they're super fall forward, they're gonna create a collapse to the front. So I get my hands underneath on the collapse. I press up, right? Here's your pattern, here's your pattern. Pause, and then it comes down, if all goes well. If it doesn't, I do an isometric. Here, up. Bring your chin down, and it muscles against me. I say, okay, stop. I let it down, and I kind of roll the head forward, and that will straighten it out almost instantly. Right? So up compression to the ceiling, isometric down, pull.
Where are you doing the pressure
Where are you?
on the back? Okay.
Yeah. I just push up that pattern, exaggerate it. I have them push me out.
Yeah.
And then I push up. Oh, my neck just cracked. That was awesome.
That's if their chin's tilted back when they're laying on the table?
Yeah, when they're like that. Yeah.
So
There's
there's
more patterning in the
Yeah.
pelvis.
And he'll kind of-
But that's a simple, quick. The other is the nuchal.
Yeah.
Right? The minute you hit that nuchal, put your knees up. So there's a ligament back here that makes us look like a reptile. Put your knees up, feet flat. And when I connect to that, a lot of times it's because there's disorganization there. And then I have her drop her belly button. I'll teach you this in the long version. And that elongates the fascia. Here she comes. Just doing it with an ongoing action. That's cool, Terry. Well done. I get to the end of that. I say you can let your belly button go. I hold steady with my hands on her neck. And then I have her put slow. And this actually, you can feel it in your mid-back, can't you?
I can feel it everywhere.
Yeah. This is a fascia piece. And then I slowly have her just put her knees down, and normally they grow towards me when the knees come down. Here she comes. Yeah.
So where do you actually have your fingers?
I'll show you. in a second.
Were you feeling the ongoing or are you seeing it?
I
Or
felt
were you
it.
know?
She did
there?
this ongoing action thing. So right in the same spot that we just were, I get, the nuchal runs right through those bumps, and I get
Do you
right,
have? You can show it on the iPad.
right there.
Oh,
Oh,
yeah.
yeah.
That would be
there.
helpful.
Can you turn around and show that to the camera as well?
Shoot, you're gonna tell me this. Yeah, right in there, and she'll get your picture.
There you
of
go.
it.
Yeah, you can
And
see
it
the
took,
nuchal
I
ligament.
couldn't figure out how to decompress the neck. The biggest thing we have is compression. If you're in a whiplash, you're compressed. If you've landed on your head, you're compressed. And for years, I'd be like, what do I do to decompress? And this is what I figured out. So it's called the nuchal ligament.
And it runs all the way down.
This is all the way to your coccyx, which
Yeah,
is
so
why
this'll-
Terry can
this-
feel it everywhere.
But
Yeah,
this will
it would-
show, is it only shows it only shows the portion
Yeah,
of
she's
it.
showing the neck part, but it actually runs every inch of your spine. And really, when you think about physics, right, we've got all these little ligaments that cross pattern this way, like a bridge, you know, and stabilizes the spine. And then we have a ligament that runs down like a tent pole in the top, right, and runs this whole leg, like a lizard. You know how lizards have that thing? The lizard. We have one of those. We're not that
I
far
have the
away.
app, I can look it up and put it on my video.
It's really cool. So that's some tips on neck.
Is there a way to do a C1 and C2 outside of phase 4? Like,
Yeah.
I would love to not, I don't know, the setup is so specific.
Or yeah, and then if they're locked, it's so impossible.
Yeah. And so I just would like to have
You know where we just palpated?
that the mastoid process.
Yep, get on either side of that. So when I get to C1, C2, I get on either side of that. And one of the things I've noticed with the reflexes, which I didn't have for years, right? I know she's pretty level, but I try to imitate the pattern. So sometimes you get on and they're like this, right? Sometimes they're like this. Sometimes one's up, one's down. I imitate that pattern. So I simply go, let's see, let me find a pad. Like, they're like this. I'll just say, here's your pattern, pause, and then it corrects.
Okay.
Because it's a reflex.
Right.
Right? Or what Melinda talked about one time, and I saw this, and I hadn't tried it because I always think if it's locked, no ongoing action will go through. And I was wrong. She does a little ongoing action into the stuckness. So it's like tiny little ongoing, which probably is a volley. But if it taper, there we go. I got it. Does that feel okay, Terry?
Mm-hmm.
Yeah. And then she's puffing back out and pushed me out. So I'm going to just volley right here, right? I just dropped to C2. There we go. oh, and that's going up through her head.
Yeah.
So, whoa, crazy, that was huge. So that shows you right there, when in doubt, do a reflex.
Right.
Let's do one on the other side. And the vulary, remember, breaks patterns, so I'm gonna just do the C2 on the other side, doing the same thing on the other side. Oops, we pause. Her head's cooking hot. Something's happening. But I do that before I even try a phase 4. And now
I
it's
don't know,
soft
I
and
just don't
organized.
just phase 4
Can
next.
you believe that?
It's unbelievable.
I just don't.
Wow. It's all soft in there. It was
Yeah.
hard and uncomfortable, and now
Yeah.
I can, like, my fingers are sinking into the tissue.
And then I got oftentimes though that once you do C1, C2, then the occiput relationship is.
Yeah.
So I
Oh,
find
that
that when
feels so hot.
I can get everything down below an occiput, but then that C1, C2, I just.
It just locks, but so I think it's something that you do need to orient to a lot.
I feel like those symptoms that you mentioned too, and I wasn't aware of them, and I should have wrote most of them down, but they're really true.
Yeah.
Because for the record, relevance is because I have every single one of those symptoms. Like C1's been whacked for a long time.
So you wrote them down.
Jaw, teeth,
Yeah.
sinuses,
All of them.
jaw, teeth, sinuses, headaches. There's more. Oh, even eye pain.
Well, I was
didn't
just
say
gonna
that.
say, what about ear pain?
Yeah.
Because I get
Tinnitus?
Yeah.
Yeah, C1, C2 can be a part of that.
And headaches.
Headaches for sure.
Yeah.
Right.
Brain fog.
Brain
Brain
fog
fog.
for sure. Anything with the cranial, like sometimes when there's some, with those cranial nerves, if one of them is impinged at all, just a little bit, they'll get facial pain, facial numbness. It's all of that C1, C2 in relationship to the cranium. But it's one of those things that sometimes if you go into that pattern with them, it doesn't resolve the problem. If you go away from the pattern, it resolves the problem because next are complicated. Yeah.
That's
1 second.
That's kind of like your thing about the tooth
Yeah.
and the jaw thing.
Yeah.
And I found it for myself. I found a great solution for me as that I used to like do it in bed, and I would, as I'm reading, I'd start in a good position, and as I'm reading, I'm slowly sinking farther and farther and farther. My neck is going more like that, or on the couch, same thing. And what I found was that I put another pillow under right in front of my sit bones. And that holds me up for
that's a good
long
idea.
enough so that I
At
can.
least buys you some time.
It buys me some time, and then usually I'm falling asleep, and I put the book down.
But that's my best way to go to sleep is to read. And then,
I do that on the couch too. I put a throw pillow. I have some of them. Anybody need it? No.
he has really pretty.
But I put it under a couch pillow, under the cushion of the couch, and that does the same thing. It keeps me from sliding on that
That's
nice low curve on like
I
that,
never
and it's
thought about
really
my
helpful.
sense bone, so that's a good one.
I was just in thinking of Brandy's client, that occiput piece that Denise taught us.
Yeah.
Was really, I do use it a lot, and the way it integrates when you look at it in the
Which
cranium, and it rotates, and it's her description, not mine, but it's very.
The way that breathes and.
Yeah, the way it interacts with the sphenoid, and it comes right up to the middle of the entire cranium.
So how do you?
So that's kind of it's not a very good right there.
And she's got glaucoma too. So it could be, your optical nerve breaks from that, but glaucoma, I don't know, we can do wonders with eyes, and I don't always know what the heck we're doing, but I know that I definitely know that our eye work is really powerful. Good stuff, you guys. Good noticing too, Brandy. I was gonna say, let me just add that piece in. Whenever you notice a pattern like that, a lot of times they might not identify it in that moment where they're doing that in their life, but they're somewhere where they're repeating that pattern, and that's kind of become their home for them. And if you ask them, sometimes they come back in and go, where I do it? I do it when I watch TV. I do this thing, and I lay on the couch like this, and they'll recognize the pattern. And then you can work with that pattern in the way that it's presenting in their repeated behavior, right?
Another head angle thing that I've done is when I always have a little time with people upright at the end of my sessions, and I have a rug on the wall and it has different bands of color across it. It's, it's a tribal rug. And so I do, whatever I'm doing with them, I always tell them, I need your eye line, and I point to a particular band on the wall and say, this is where I need your eye line to be. And I found that a lot of my clients, by about the third or fourth time they come back, and I remind them that, they'll say, I've noticed I do this too much, or I've noticed I do this too much.
Oh, cool.
And it helps them get a reference
Yeah.
for what a
Orientation.
neutral eye line can be.
That's
Yeah.
great.
And they start to feel it in their own bodies.
I read something about that, and that neutral eye line is really good for for dementia. Like if you can keep your eyes at neutral periodically, it helps your brain fire better. So good work, Jen.